Getting a flu shot reduced the risk of a heart attack and related cardiac events by 34%. The protection was even greater in people who had recently experienced heart trouble. Many patients have told me that they don't see the value in getting flu shots because it's just the flu. They imagine that influenza, the flu, is nothing more than the common cold and will just go away in a few days. Unfortunately, the symptoms of the flu are usually more severe than those of a common cold. Worse coughing, much worse aching and fatigue, and higher fever. In addition, the effect of the flu on the lungs can cause blood oxygen levels to drop to death. As a result, the flu can lead to hospitalization and death. This is not just a rare event. The CDC estimates that from 2010 to 2020, the flu resulted in 140,000 to 710,000 hospitalizations, deaths each year in the United States. By comparison, about 40,000 people die in auto accidents in the US each year. How does flu affect the heart? The virus only rarely infects the heart directly. Instead, the adverse effects of the virus on the heart are due to atherosclerosis of the arteries of the heart. Many people over age 50 have atherosclerosis, and in some people, it has not yet been diagnosed. Because atherosclerosis narrows the arteries and reduces the flow of blood, less oxygen reaches the heart muscle. Is this risk more than theoretical? Many careful studies have shown there is an increased risk of heart disease following a bout of flu. In one study of 80,000 adults with influenza, nearly 12% had a serious cardiac event, such as a heart attack, during or in the weeks after Although having the flu definitely increases the risk of a heart attack, what's the evidence that getting a flu shot protects against a heart attack? An analysis published online on April 29, 2022, by JAMA Network opened the results of 6 randomized trials involving over 9,000 people. So, I agree with your doctor. The fact that you have heart disease makes it is even more important that you get a flu shot each year. The same is true of people who are at increased risk for heart disease, including people over 60, smokers, or anyone with high blood pressure or diabetes. Play it